Hi, welcome to the Fit and Healthy Today show. And I got a little bit of inflammatory tracheitis, so you'll have to bear with me if I don't come out as clear. I'm doing the best I can. I usually pick my subjects based upon the amount of customers that come in with various issues throughout the week and just let God guide me. And for some reason, it seemed to be this issue, genital herpes. Kind of a delicate issue, and I'm going to handle it in the best I can. The most common venereal disease now out there. It affects 35% of our United States population, with 80% of that 35% being between the ages of 20 and 39. So chances are good, if someone's in that age category, you got a 50% chance of coming in contact with someone who has genital herpes. Now, it will lay in remission along the spine, and it's not contagious at that time. But when it comes to fruition and it breaks out into the little recurrent types of blisters, it's highly contagious. So in a woman, sometimes it may be difficult for a guy to see, but a woman can usually see it in a man. Men will get the little sores on the penis, and they'll also have a discharge. If they're in the early discharge state, you might not always know if they have an infection in that regard. So protection is until you know whether or not somebody has had that, and hopefully honesty in speaking about it. A lot of people hide it and conceal it because, you know, obviously it's not a pretty sight when you look at it. And you can take a peek and see what it looks like online if you want to know what you're into. It is not curable to date. It is controllable. And there are medications out there that have quite a bit of side effects that are antiviral agents. But there are some natural ways that we can control it with diet as well as supplements that can keep the reoccurrences down to almost bare minimal, unless there's really something that triggers it, and we'll talk about the triggers. It increases the risk of cervical cancer. So if you've got it, what happens then under those circumstances when you have it will increase your risk. So being aware of that, you need to be very cognizant of getting your yearly pap smears if you have genital herpes. In infant times, it increases the risk of blindness. So for example, if a mother has an outbreak at the time she gives delivery, oh boy, if that comes in contact in baby's eyes, it can cause blindness, it can cause death. So if you have genital herpes, you need to let your OBGYN know that you have it, and if you have or suspect any type of outbreak, you have to have a C-section. That's just all there's to it. Highly contagious, and we don't want baby catching it in their eye and go into their brain or their nervous system. Very, very dangerous. Okay? Root causes. Obviously, sexual contact is the main way it's transferred. But believe it or not, you know, the old stuff they taught us back in school, that you can't catch venereal diseases from a toilet seat, well, they're kind of wrong about herpes. So use the covers when you're sitting down on the seat as best you can, or if you've got the sanitizers. This is contagious, and it's been shown to live up to 4 hours on toilet seats. So no putting the butt down on the toilet without the protection, okay? Immune system suppressed. It will trigger and it will come about when the immune system gets suppressed because of stress. You overwork, anxiety, you have a high fever. Women who are menstruating, they get under physiological stress. That also increases the risk of an outbreak as well, too. Nutritional deficiencies. If the Lysine, L-arginine ratios, and those are amino acids, if you end up with a higher ratio of L-arginine to L-lysine, that can also trigger it if it's laying there on the spine, and it can trigger a reoccurrent outburst. When we're talking about the things that we can do to prevent, which we have obviously is protected sex, but once you have it, the things that keep it from reoccurring, diet and supplementation, oh, they work. I have, well, we've had our stores for 13 years, and I know here in Lompoc I've been there for 8. And I have customers that came into me years ago, some of which have never had a reoccurrence. And they would get it, and they would come out every 3 to 6 months. Particularly seems to be more so in the winter months. Just seems to happen. Same with cold sores, which is herpes simplex. It's a virus 1, whereas the genital is a virus 2. The diet. So, knowing that if you have too high of an arginine ratio to L-lysine, under these circumstances, we want to eat L-lysine-rich foods. And you know, in the olden days, they used to say avoid chicken and turkey and all of that if you had cold sores or genital herpes outbreaks. But actually, that's not the case. The foods that are rich in L-lysine include beans, turkey, fish, chicken, and lots of veggies, lots and lots of veggies. You want those veggies in there particularly to alkali the blood, because when you're in an alkali state, your immune system is going to be at its optimal level and you're not acidic. So if you turn around and you eat acidic foods such as tomatoes, sugar, red meat, alcohol, or once again if you have these other triggers, but from a dietary standpoint, alkaline the blood. If you feel any tingling coming on, and obviously the symptoms of this include burning, itching, a sensation of reddening, or any tingling coming down in that area, or formation of a blister, you want to immediately get that diet under control with the L-lysine and arginine ratios. That can stop it from progressing and help it go back into the spine and sit there and wait for the next time. Hopefully there not being a next time. You want to avoid arginine-rich foods such as chocolate, peanuts, wheat, and almonds. I know almonds are essential fatty acids, and we want good fats in our diet, but for some reason, those particular offenders, avoid them like the plague because they're high in L-arginine, and when you get those ratios off again, then the herpes, be it cold sores or be it genital, will come to fruition. It can be very, very painful. And actually, there's a lot of people who require psychological counseling once they get genital herpes, because it's all of a sudden the sex life changes, the way you have to handle and deal with your diet. There's a lot of additional amounts of changes that have to occur. And if you abide by the dietary changes, it really will help and keep these reoccurrences from occurring. The supplements, and the ones I've listed on here are the ones that are researched. And if you know me, I always give you the research that backs it up. To me, the science is important. The voodoo medicine, I don't care about. L-lysine, 1,000 milligrams 3 times a day on an empty stomach if you have an outbreak, immediately on an empty stomach. And I have doctors who say, oh, that's where, no, because once again, remember how we talked about that L-lysine-arginine ratio? We want to get the arginine ratios down and the lysine ratios up. There's multiple studies on this. I mean, multiple university studies that support that it reduces the pain, shortens the duration of the virus as well, decreases the frequency and lengthens remission. And remission, we want it sitting back in there, we don't want it coming out. Because once again, when it's in remission, not contagious. Ester C. Now remember, I'm not a fan of ascorbic acid because it only stays in the body 2 to 4 hours and it excretes calcium out of the bones and you pee it out. Ester C is a mineral ascorbate vitamin C. 1 to 2,000 milligrams 2 to 3 times a day. Really helps you fight infection and it aids the healing of the skin. Because remember, our skin is this pliable, flexible, collagen type of fibers, cells. Well, vitamin C helps stimulate collagen production, so it helps it heal. But from an immune standpoint, despite what the AMA may say, tons of studies on vitamin C in the immune system and on vitamin C in all herpes viruses, including cold sores. Well, I mean, we can stop them. Boom. L-lysine and vitamin C I've seen stop, boom, in its tracks. Immediately stop the herpes from coming to fruition. B complex. A good multiple in combination with higher amounts of B helps the skin tissue repair. And the Bs, remember, we talk about that in just about everything. The Bs help you deal with stress, both physiological and psychological stress, besides helping with other mental disorders and other things. But once again, since stress is one of the main triggers of genital herpes, keep those Bs high, particularly if you have a stressful environment. You know, you're a working mom, a stay-at-home mom, or you got that hard-pounding a job with a lot of stress, or the desk job as a computer scientist. Zinc, copper. Now, a lot of physicians will send people in to come and get zinc for their immune system, and I'm like, okay, that's good. But remember, zinc offsets copper. So if you're taking zinc for more than a week, in excess of 30 milligrams, you need to be taken into balance with 1 to 3 milligrams of copper. Zinc stimulates the immune system. It also aids in skin healing. There are actually zinc creams, and I know at our store we have these herpes creams that people come in and grab that can help heal it as well, and most of them are zinc based. Zinc aids the healing in combination with C and E. Vitamin A. Now, there's some studies that came out about vitamin A, I think that Ralph mentioned in our last show, about the lighter skinned you are, the poor absorption you have of beta-carotene sources. So there's a lot of people in this country that are vitamin A deficient because they're told they don't need a multivitamin. Vitamin A helps with the immune system. And if your immune gets compromised with whether it's a herpes simplex virus, coronavirus, whatever it is, increasing the vitamin A really helps you fight off infection. Staph infections too, there's a lot of research on that as well. So you can increase your dosages of vitamin A as long as you're not pregnant for a short duration in order to bolster the body's ability to fight off infection with a combination of vitamin C. Probiotics, the good bacteria. Now I've mentioned before that 80% of your immune stems from in your bowel. And that means eating good foods and drinking a lot of water and having a high enough fiber diet. But it also means keeping these good little critters, probiotic meaning pro-life, having adequate amounts of these good bacteria. If you don't have adequate amounts, you're going to get sick. It's not if, you will. So if you go on an antibiotic, oh boy, one of the biggest things I've seen to trigger this is, besides the diet or the ratios of arginine to lysine, is antibiotic usage, because it makes you very acidic and it kills all your good stuff off, so your immune system just goes kunk. So on an antibiotic, which means anti-life, you take a probiotic, which means pro-life, and that will get those bacteria laying in there again. Lemon balm extract or cream. The studies supported fewer outbreaks and fewer symptoms. So if you feel that tingling come along, and the same that goes with L-lysine creams as well. But lemon balm I found quite a few studies on. Topically applied in a tincture or a cream helps healing, and it prevents the outbreak from coming to fruition. So that's the whole point. If you know it's coming, prevent it from coming to fruition. Propolis tincture. Now propolis is a bee product. And there you can do the tinctures, or there's ointments that you can get that have royal jelly. And propolis has a way of stimulating certain enzymes in the skin to help with healing. You're even finding it in some of the beauty creams nowadays for anti-aging, because it's an antimicrobial. It kills viral, fungal, and bacterial infections. It's what the bees use to help kill off the stuff in the hives. So it also helps kill infection and speeds healing as well too. There's a homeopathic called Nosoda, and not real common. You don't usually find it in the stores, and it has to be special ordered. But this homeopathic medicine stimulates immune response specifically to herpes. So you're going to have to probably special request it ahead of time in a good local health food store so that it can be on hand when you come out with an outbreak, because boy, it can sure stop it in its tracks. Licorice root. Now licorice root has so many studies for so many different things. We talk about licorice root for ulcers. We talk about licorice root for irritated bladder issues, stomach, adrenal glands. Licorice root kills viruses, bottom line. And I'm not just talking about herpes, but herpes, if it is internally taken, licorice gets in the body and it'll kill off and also help with chickenpox herpes. Any type of herpes viral, it will attack. The only problem is, if you've got high blood pressure, you have to do a diglyceride licorice, which removes some of the key components out of it that can trigger blood pressure issues. I actually have people come into the store